Pollution kills at least 9 million people every year. That's an increase of 7% between 2015 and 2019. South Africa is no exception, though. In fact, it's the sixth most affected country. The deaths are blamed on industrialization and urbanization. Let's discuss this now with environmental activist Desmond D'Sa, who joins me now for this conversation. Thank you so much for your time, Mr. D'Sa. I mean, this is quite worrisome. The number staggering, 9 million people per year being killed by pollution, or dying at least from, air pollution, amongst other things. This is in Africa alone, according to this particular study. Quite worrisome, I have to say. May you please unmute yourself, Desmond? I think you can hear me definitely. We seem to be struggling to hear you from our end.
Okay, I can hear you. Thank you so much. Good morning, everyone. Let me just say that, we've done 12 studies in Durban in 2002, and one that was completed, the second one with the government, the national, provincial, and local government, completed in 2007. And both the studies showed that there was a correlation between air pollution as well as the chronic illnesses of asthma, cancer, and leukemia in South Durban. So this has been well known in the community for a number of years. We also have done a community surveillance on people who have cancer and leukemia in the area. We are known as Cancer Alley in South Africa. One of the highest rates of cancer where we bury people on a regular basis is in South Durban, where South Africa's big supplies 9% of South Africa's gross domestic product. In other words, we have the biggest petrochemical industry in this country.
With that being said, Desmond, I mean, we know that air pollution alone from industry processes along with urbanization contributes to the 7% increase that we've seen from 2015 to 2019. What can actually be done to ensure that no more person loses their lives to air pollution?
I must say that the Mandela government, brought in the Air Quality Act, one of the most progressive air quality acts in this country. And then we had the multi-point plan in Durban that looks at ways and means of how we reduce the harm, the air pollution on society. However, that has been dismantled. Out of the 14 monitoring stations in Durban that used to work and operate properly and cost millions of rands, only 5 of them are operating. So it doesn't give you an indication of how far government has gone in reducing the harm on society as a whole. We know through our own air samples that we take as community that there are huge amounts of pollution being emitted on society. And these huge explosions and fires that we had in June 2021, like the UPL, like Engen itself, and other refineries that have blown up over the last 2 years, there has been a huge impact on society, and poorer communities in Blackburn and Umlazi and the townships in South Durban are impacted the most because they're already living in inhumane conditions. The air pollution comes through their homes, and they don't have the necessary medical treatment at the government hospitals that we have here. We had the last 2 years, we've had COVID. But wanting to deal with air pollution, they send you home because they don't have the chronic medication that is required to treat people from air pollution.
And I mean, I'm just reading a quote here from Richard Fuller, the study co-author, who said that, and I want to quote him, "We're sitting in a stew pot and slowly burning. We haven't given environmental pollution much focus." I just wonder, with the facts that you also present in our conversation this morning, could it get worse? Could this number increase? Could we see more and more people being affected? You've just made the example of those who can't even afford medical care, having to live with the effects of pollution and unfortunately deteriorating their quality of life.
Well, at the moment, Durban, we've got both the refineries that are completely shut down. And so you can see Durban, if you're living in Potchefstroom and miles away from in the north and as well as the west, you can see Durban. That shows clear skies. And people are not complaining because you don't have the pollution irritants that affect your lungs and all that there. So at the moment, the pollution levels have gone down because of the closure of both the refineries, Engen and Separate. However, if there's an increase in what of the chemical industry and what government's program is to increase and to develop fossil fuels further, we can see a problem. We're already beginning to see the expansion of the chemical industry in areas that previously did not have any problems, health problems in those areas, such as Richards Bay and some of the townships in surrounding the mines in Matuba and all that. So certainly, yes, if there is an increase in pollution, then there's no doubt about it. The science, the health surveys are showing that there will be an increase in health problems in local communities, especially in poor neighborhoods where people just don't have access to clinics and hospitals.
Well, I'll leave our conversation there, and I appreciate you speaking to me this morning. Environmental activist Desmond D'Sa, thank you so much for your time this morning.